Ticket R 004.
This is a very smart virus. The reason why I say that is we don't know exactly how it works, where it goes, the way it infests our body. It's unpredictable.
Have you noticed any swelling in your legs?
My name is Dr. Jamie Spiegelman. I'm an internal medicine critical care specialist at Humber River Hospital. We've been going through this for about 1 month now. The first couple of weeks were kind of scary, actually, because we weren't sure what we're getting into. We've never really faced anything like this before. We don't understand it, obviously. We don't understand how to treat it entirely. The physiology of it is completely different than any other virus that we've seen. What happens is, for the first 5 to 10 days, they're okay. They have flu-like illness, they have a sore throat, they have a cough. The patients that get really, really sick at around day 8 to 10, and this is quite consistent, it's actually quite scary. 8 to 10, they come to the emergency room really short of breath and hypoxic, so they need oxygen. And within an hour or two, they're intubated. One of the older people definitely get sicker than younger people, but we've seen random young people, 23-year-old girl. We have a couple of guys upstairs in their 40s who are critically ill on a ventilator. So this does not discriminate. Whether you're rich or poor, old or young, if you get this disease, it's a bad disease if your body responds poorly to it. I've probably intubated 15 or so of these patients to date. None of the doctors have gotten it, none of the nurses that I've worked with have gotten it.
We're always seeing the worst case scenario in the ICU. We'll be doing a protected intubation. Any intubation is always tricky. Lots of things can go wrong, which is why we have a plan A, a plan B, a plan C, in case things don't go well in there. The big thing is protecting ourselves and protecting our team, so making sure we're following the appropriate donning and doffing procedures. Yeah. Having somebody watch us, make sure we're covering all our bases. And when we leave, making sure we're doing one by one and slowly, bit by bit, making sure we're carefully following the appropriate regimen to make sure we're not contaminating ourselves, because this is a high-risk procedure for spreading a lot of COVID.
Ticket R 004.
We're going to help you with the breathing. We're going to put you on the breathing machine to help you, okay? We're going to take good care of you. Right now she is, working to breathe. If she didn't have the support of the breathing machine, then her muscles would tire out, her oxygen level would drop, and she would likely pass.
Face shield. Hair cover.
Normally, before the COVID era, if someone had to be intubated, we'd all, we'd put on a mask, but we'd really all kind of rush into the room. Now, we have to do things a lot differently. So the main thing that we need to do is prepare, be focused, and make sure that everyone knows the plan going in.
Hey guys, meet the crash cart. Crash cart. Just one, please.
Level 6, room 619.
Just one,
Stats are good, heart rate's good. So everything's good now. She's stable. It was a difficult intubation. Unfortunately, it happens whether you have COVID or not. So we have to use special techniques to intubate her, but she's okay now. Blood pressure's okay. Her heart rate went down and her heart stopped for maybe like 10 seconds. So we have to do CPR, but she's back.
Because all you want to do is help these people and our patients, but just watching them desaturate so quickly and not be able to do everything that we can all the time to help them it is really frustrating, and it's terrible.
Tilt head forward. Pull it up, throw it out, wash your hands.
It's difficult. There's patients going through a lot of very severe illnesses, and in those moments where there's high stress, every family member just wants to be there holding their hand, and they can't.